Could mold exposure in my home actually be causing my chronic fatigue, brain fog, and weird symptoms that no doctor can explain? That's a common question I hear as we see mold exposure going up. And yes, mold-related illness has a clinical name. It's called Chronic Inflammatory Response Syndrome, or CIRS, C-I-R-S. It is a measurable biological condition with validated biomarkers. Here's what happens. Water-damaged buildings harbor toxigenic mold species, like aspergillus and penicillium, for example. These molds produce mycotoxins. Mycotoxins are small lipid-soluble molecules. They cross your blood-brain barrier and accumulate in fat tissue. About 24% of the population carries an HLA genetic variant that prevents proper immune clearance of these mycotoxins. That's almost 1 in 4 people out there. And in those patients, the immune system stays stuck in a chronic inflammatory loop. That loop affects nearly every organ system. These symptom patterns are recognizable once you know what to look for. Fatigue that does not improve with sleep, cognitive impairment your doctor calls brain fog, muscle aches without any exercise, light or sound sensitivity, static electrical shocks, unusual thirst and frequent urination, tingling or numbness in your extremities. At SeeBeyond Medicine, I diagnose CIRS using validated tools. I run specialized mycotoxin testing on your urine. We also look at other lab markers like TGF-beta1, MMP9, C4A, MSH, and VEGF. None of these appear on standard panels, and they tell me whether your immune system is trapped in a biotoxin-driven inflammatory cascade. Treatment requires source removal first. No protocol works if you continue to inhabit the contaminated environment. That means an ERMI test on your home or workplace to quantify mold burden. Then we use binder protocols like cholestyramine and charcoal. Binders sequester mycotoxins in the gut and prevent enterohepatic recirculation through the liver. Recovery, additionally, we use IV therapies to boost your immune system as well as detoxify your system, like ozone therapy, which additionally will treat your blood with UV light to help kill microorganisms. Other therapies would include high-dose vitamin C, IV CBD. These will all help to stimulate your immune system. Other therapies would also include detoxifying agents like N-acetylcysteine, glutathione. These treatments will ramp up your immune system as well as binding these mycotoxins and help to excrete them from your system. Recovery is not fast, it is achievable. The patients who heal are the ones whose physicians actually believes the diagnosis exists. At SeeBeyond Medicine, we do believe, and we're here to help you walk that journey to clear yourself of mold and mycotoxins.